Hello, my name is Millicent Adikibe, and I'm doing this brief presentation with Edwin Wogo. This is University of Massachusetts Global DMP, Evidence-Based Thinking for Scholarship and Practice. Statistical significance versus clinical significance. The purpose of this brief presentation is to discuss the statistical and clinical significance in studying, conducting, and utilizing research studies in nursing practice. Statistical significance is a research term which denotes the use of numerical data to prove the probability that study findings were not by chance. Clinical significance is a measure of the practical effect of a research study on the patient or consumer. This is the difference between the intervention and the control groups, also known as the treatment effect size. This determines whether the results of the trial are likely to impact current medical practice. In practice, though, a statistically significant study may not be clinically significant. The importance of statistical and clinical significance in research analysis. The research process usually starts with hypothesis testing, where probability P is compared with alpha, selected level of significance. It must be noted that statistical significance is related to data obtained from the study, sample, or population of interest, whereas clinical significance is the outcome measured at individual or end consumer level. A research study must be clinically significant to benefit the patient or the practitioner, otherwise it is not considered worthwhile. Example. A good example of statistical significance is null hypothesis, which states that there is no relationship of interest studies, that is P less than 0.05. Research hypothesis states that there is a relationship between these variables. An example of clinical significance is a hypothetical study to evaluate weight loss intervention where the intervention subjects lost about 2 pounds less than the non-intervention group. The difference in weight loss in this case may not be statistically significant, but may be clinically significant if the individual participant recorded an improved sense of well-being. It is very important that clinicians evaluate the level of clinical significance of a study. For instance, a new drug may statistically be significant, but when given to patients, the level of improvement or result compared to an older treatment does not create significant difference to what's changing to. Therefore, making it less desirable, or the cost of new study may not be economically sensible for the consumer. That is the end of my presentation. Thank you.